is to imagine that policymakers are solving a cost minimization problem where they are trading off the cost of the health outcomes against economic costs of the interventions. So I see this as a model for predicting policy interventions and thus the course of the pandemic, but not for making recommendations to policymakers. Its assumptions are a little too strong for that. I will start by reviewing some epidemiological concepts. Then I will present the model, which is a Markov Decision Process model, where you work backwards from the end states of the epidemic to find the cost minimizing sequence of interventions. The model chooses from a menu of interventions. Each intervention is characterized by two things: its daily economic cost and the rate of transmission, or R naught, that results from it. Once I have a solution to the model, I will project the course of the epidemic based on an estimate of its current state, the share of the population that is immune, and the share of the population that is infected. So in the model, the costs of the epidemic and the costs of the interventions are converted into monetary values and traded off against each other. Despite being an economist, I realize that not everyone is comfortable with the idea of converting outcomes such as death into dollars, but there are well-established techniques for doing so that are used in health and safety regulation and in cost-effectiveness research. So researchers estimate quality-adjusted life years, or QALYs, associated with an illness or a treatment, convert those QALYs into dollars. So each person who dies from COVID loses some number of QALYs. Survivors of COVID might lose QALYs as well because of long-term health effects, including respiratory, neurological, and heart problems that shorten their life expectancy and lower their life quality. On the other side, you have lost GDP, lost education, parents who stop working to take care of their kids, and potential scarring effects of those unfortunate to graduate into this situation. Estimating these costs carefully would be a whole presentation, perhaps an hour-long presentation. I'm not going to get into my measures of these costs. Rather, I'm going to use a kind of illustrative placeholders for the costs on each side of this trade-off that I'm hoping are in the right ballpark. So the herd immunity threshold is widely talked about. It's the proportion of a population that needs to be immune for the rate of transmission to drop to 1. So if every 2 infections lead to 5 infections without immunity under an R naught of 2.5, which is a central estimate for that of COVID, then 3 out of 5 people need to become immune for us to reach a situation where every 2 people infect 2 others. It's important to note that policy and immunity can combine. So here you see that 2 out of 5 infections are stopped by policy and 1 by immunity. Suppose we have a relatively light intervention that leads to an effective R naught of 1.5. Then the intervention reduces the number of infections caused by the two infected people from 5 to 3. Then you only need 1/3 of the population to be immune to reach an effective herd immunity threshold under that invention. So under an effective R naught of 1.5, the effective herd immunity threshold is 1/3 rather than 3/5. The distinction between the herd immunity threshold and the attack rate is very important. This is a projection of what would have happened without any intervention in the United States. So you can see that infections start to shrink at the herd immunity threshold, but after they start to shrink to 0, approximately half as many people get infected as when the epidemic was growing up to the herd immunity threshold. So that the attack rate measures the share of people who are infected by the end of the epidemic. But you're not necessarily out of the woods when you reach the herd immunity threshold. A minimal goal of interventions might be to avoid overshooting the herd immunity threshold. Okay, so here is a different representation of the path of the epidemic, and this is in the state space of the Markov decision model. So a state space is a set of possible conditions of the epidemic at any time. And here we have it based on two dimensions: the share of the population that is infected, and that's on the y-axis, and the share that is immune on the x-axis. The sum of these two shares can never exceed 1. So this is a triangular state space bounded by a negative 45-degree line. Under no intervention, the epidemic takes the higher path through the state space. Under an intervention with an effective R0 of 1.5, it will take the lower of the two paths, and that means that the maximum number of people infected at any one time will be lower, and the ultimate attack rate will be lower as well. So visualizing the path of the epidemic through the state space is different from visualizing it through time. Time is like not a dimension in this figure. So if you look at 1 centimeter of these lines, that could represent vastly different amounts of time, depending on which curve it's on and where in the curve it's on. Let's say, so before getting into the model, I think I just wanted to build some intuition about when a policymaker might want to apply different policy interventions. So the model can deal with as large a menu of policy interventions as you like, but for illustrative purposes, I'm going to be looking at a menu of 2 interventions. One sustainable intervention where we wear masks, use contact tracing apps, put up glass barriers, and maybe close gyms and bars. I realize that some people would not find the last part sustainable. Then an unsustainable intervention where we essentially lock everything down. Now suppose a policymaker says, well, I want to go with the sustainable policy most of the time, but also blast the epidemic with a lockdown for 30 days. And here we're presenting 3 alternatives to a policymaker for when to deploy that lockdown: early in the epidemic, at the middle, and late. And so it turns out that the middle timing is like the Goldilocks one. It is just right. If you deploy the lockdown too early, then cases will recover and grow, and you overshoot the herd immunity threshold. If you deploy the lockdown too late, then you will already have shot the herd immunity threshold when the lockdown is deployed. But if you deploy it just right as you're approaching the herd immunity threshold, and that causes the epidemic to shrink just at the time it was shrinking anyways. And you sort of reinforce that natural process of dying out of the epidemic. So timing matters. And here what we did is choose the cost minimizing sequence of policy out of a set of 3 alternatives. But what the model is intended to do is solve for the cost minimizing sequence out of every possible sequence. So how does it do that? And the answer is by working backwards. So this robot is here to help me demonstrate the basic idea. So the maze is a different kind of state space that we also can treat as a Markov decision process. If you give this robot a map of the maze, what it will do is work backwards. So it will start at the exit of the maze, calculate the number of steps out of the maze at each square until the whole maze is full of numbers indicating how many steps out, which for this purpose is like the cost measure. And then it'll enter the maze and follow a simple policy rule. Go in the direction where the number of steps is lowest. So it will go forward 2 steps from the top left, and then it will need to decide whether to go forward towards the 25 or turn towards the 23. And so it's going to turn, and it'll keep following that rule through the maze. So we're gonna estimate a model like this for the epidemic and sort of navigate through the epidemic accordingly with policies. So we need to start at the end of the epidemic. So what is the end of the epidemic? Where in the state space is it? So think of a point like this one. So the coordinates 0.65, 0.03 indicate that 65% of people are immune and 3% infected. So again, this isn't an indication of where we are now. This is some point in the state space of the epidemic where we could be at some point in the future. It's beyond the herd immunity threshold of 60% under an R0 of 2.5. And so the epidemic is about to shrink to 0 no matter what. But we have to decide whether or not to let it shrink on its own, or hasten that process with interventions. So we can save a lot of lives with the lockdown in this example, only 80,000 people, subsequent to reaching this point of 65% immunity will die under an unsustainable lockdown policy, 108,000 under a sustainable one, and 280,000 more if we have a do nothing policy. And along with those additional deaths, as I mentioned earlier, would be all kinds of health effects on the survivors. Now, in the table here, we add the economic cost of the interventions. I said I was going to convert deaths to dollars, but here we kind of do it the other way around. We convert dollar economic costs to sort of equivalent deaths. And so you can see that even under an unsustainable policy that does economic damage equivalent to 1,000 deaths a day, it's still the lowest cost option at this point because it saves so many lives. So the Python program looks at these three totals. It assigns unsustainable policy to this node and also records the cost. The cost is interpreted as the remaining cost of the epidemic, both economic and health, if you reach this node. And so just like the 15 spaces to the exit, in the maze that we were discussing last slide.
3 minutes.
Thank you. So we calculate the cost in action at several points along a 45-degree line, and then use those points to interpolate the rest of the line. We move backwards to a previous line where the immune and infected share sum to a lower total, and figure out the cost and actions at nodes on that line based on where each action is going to take you. Once we have the entire state space filled with costs and policy choices, we can work forwards from an initial point. So this diagram shows us how. So the arrows are color-coded, indicating which policy is taken at each point in the state space. And they also indicate the direction the epidemic takes under that policy. The blue arrow in the diagram indicates sustainable policy, and the red arrows shows where the model would choose unsustainable policy. So this diagram is like a slope field from a differential equation model, but with two different functions for the slopes. The dark black line shows the path the epidemic would take from an initial point that is roughly where I estimated the epidemic to be in the end of June. And so here is a projection of the epidemic that corresponds to that same graph. As you can see, it called for a surge and then fall in cases. That's aged reasonably well since the end of June. The epidemic peters out when immunity reaches a level that, combined with sustainable measures, brings the rate of transmission below 1, which is what I was calling earlier the effective herd immunity threshold. Let's just compare that to a couple other projections. If you set the parameters differently, such that the epidemic can be contained easily under sustainable temporary measures, which would have an effective R0 of 0.99, then the epidemic would end much more quickly under the policymaker's choice. Here's a case where you essentially inform the model that a vaccine is coming much sooner then it sort of turns out not to under this projection, and where you also estimate a much higher healthcare cost of mortality. In that case, the solution of the model is essentially to hold the epidemic at bay by turning on and off the unsustainable policy measures, and you never reach within this time period the herd immunity threshold. So thank you very much. I look forward to your questions. I hope I left some time, and I look forward to the next presentation.